Welcome, welcome, welcome. Happy Wednesday, everyone. Welcome to a special episode of Mind, Your Body, and Soul. I am Joseph Ward. My co-host, Matthias Sweet, he is out this week. Much needed vacation. He works a lot, so much needed vacation. So a big shout out and a thank you to Matthias. Remember, this is Mind, Your Body, and Soul. This is the healthiest podcast that you have heard in your entire life. And our goal is to make sure that we connect our community to the resources and the people in our community that can provide the resources to them, and also provide information and education to our community, things that they may not always have access to. So that's what we do here at Mind Your Body and Soul. So we thank you all for tuning in. Thank you for the continued support, not just for Mind Your Body and Soul, but for Neighborhood Medical Center as a whole. And make sure you visit our parent website at www.neighborhoodmedicalcenter.org, as well as our podcast website, www.nmcpodcast.com. Now, today's interview I am excited about. I think the first time I can remember being in contact, seeing this gentleman, it was a mental health event at New Mount Zion here in the Frenchtown area. It was a while ago. I think Nicole Everett was the host, and our CEO, Mr. Nate Freeman, she told us about the event, and we went to set up the event. And Dr. Reeve was one of the guest speakers, one of the main speakers at the interview. And I enjoyed his passion, his words, and just the wisdom that he gave us. But in addition to that, he's one of the people that we can literally see in our community, helping our community. We can see him on a regular basis. We can see him every day in the community. He's not just a CEO who's behind the ivory tower. He is accessible, and I really appreciate that. Over the years, this gentleman, you can just see the work. He's in the trenches. You can see him working with the people and helping to help make sure our community is better, especially in the realm of mental health. So I'll give you a bit of background information. So Dr. Reeve has been the president and the CEO of Apalachee Center since 2008. Apalachee Center is a non-for-profit behavioral health center operating 12 outpatient clinics, 3 acute behavioral health care inpatient units, 3 outpatient primary care clinics, and 7 residential programs across the 8 counties of the Florida Big Bend area. And he manages the behavioral health center at Tallahassee Memorial Healthcare. So we're talking about a network that employs over 700 staff members and treats about 12,000 clients on an annual basis. So he has a huge job, and he does it well. He's also a commissioner of the state of Florida's Commission on Mental Health and Substance Use Disorder. And in 2023, this year, the governor promoted Dr. Reeve to the chair of that commission. So Dr. Reeve is also chairs the Mental Health Council of the Big Bend and the Behavioral Health Council of Florida, of the Florida Hospital Association. And he has a wealth of knowledge, a wealth of accomplishments, and we are happy to have him here. Dr. J. Reeve, welcome to Mind Your Body and Soul.
Well, thank you very much. I appreciate the very kind words. I'm tired just listening to you. So. But I appreciate saying that. Thank you.
Oh, no problem. Thank you once again. Thank you very much. As a native Tallahassean, I'm very grateful on behalf of my community to anyone who spends the time and put the time and the resources in to help make our community better. It's a decision that we can make. Some people can make the decision to just care about themselves, but you were one of the ones who made the decision to care about the community as well. So, like I said, as a native Tallahassean, I appreciate you. Yes, sir. So a little background information about yourself. Could you tell us, why did you choose mental health? What is it about the world of mental health that made you make this choice? And what were some of the key moments in your life that kind of push you toward the mental health realm?
Yeah, sure. And just before I get into that, I want to give my appreciation to you and to Neighborhood Medical Center as well. You guys are great community partners. You do a phenomenal job. So we love working with you here at Apalachee. So I wanted to make that point. You do a great job.
Thank you.
So yeah, in terms of choosing mental health, really, if you kind of boil it down, mental health kind of chose me as a field. I was born into a family. I'm the only child of a single mother, but was born into a family that had been pretty heavily impacted by serious mental illness. I had uncles and aunts who were diagnosed with schizophrenia, and folks that I grew up with. But when I was growing up, I'm just about to turn 60. So back when I was growing up in the 60s and 70s, this was a taboo topic, right? People, especially in upstate New York, did not talk a whole lot about mental health issues. So it was clear to me that the family that I had and many members of my family were kind of different from other families, very different from sort of the media depiction of what the sort of perfect family is supposed to be like. But I didn't really put any of that together until I was in graduate school. Actually, I was doing a master's degree in something completely different than this field, and I was working my way through school and had to get a job. I actually had two jobs, and one of the jobs that I was working at, a library job, cut my hours down for the summer, and I didn't have a whole lot of money behind me, so I was kind of like, well, okay, I better go get a third job. And I was fortunate enough to get a job as a mental health assistant at an area hospital. This was up in Cambridge, Massachusetts. And, it was no experience necessary. I went and interviewed for the job, and the head nurse said to me, why don't you spend some time on the unit talking to clients, just because you've never done this before. Like, see what it's like for you. And tell you I did that, and in the hour or so that I spent on the unit, my life changed completely. Now I was 20 at the time, so when you're 20, your life changes with some regularity. This one kind of stuck. Right. This one kind of stuck for me. There's a quality to talking with folks who are in the midst of acute psychotic crises, particularly schizophrenia, but also with bipolar disorder and some other illnesses. That's just, it's different than everyday conversation. And I'm not talking really about like the delusionality or the hallucinations. There's sort of a quality of vulnerability and unguardedness. There's kind of an honesty with clients with folks who are living with those illnesses, and I was hooked right away. It didn't occur to me that I was hooked, in part because it was very reminiscent of my childhood and the folks I talked to growing up. But I was kind of like, well, this is great. This is what I want to do. So happily, I got the job and switched around everything I was doing in school and ended up becoming a clinical psychologist and worked in this field. I mean, I've worked in this field since I was 20. So just about 40 years, I've never had a job that wasn't connected with behavioral health, and that all goes back to my family history, which I started coming to terms with, and actually not until I was getting my PhD, and uncles and aunts started passing away, and that's when I started finding, the letters from the state hospital and the medications, and it all sort of clicked for me. So that's kind of how I got into this field. This was it was very much like a calling, and something that this was the path that was laid out for me.
Yes. It's amazing how some of us find our purpose, because similar to you, how I got into HIV/AIDS, I knew nothing about it. It was an opportunity that was better than throwing newspapers at the time, because I used to work for the Tallahassee Democrat.
Exactly. Very similar.
Right. And got into it and it changes your life. You get a different perspective just on yourself and how you can help people, but just what's available out there as well. So now that's amazing. So over 40 years in mental health.
Mm-hmm.
That's amazing. And so after you got your first job. So what was I guess the first opportunity that you got as far as to move up within an organization or to move from one organization to the next, and you're starting to see your trajectory start to rise and rise?
Well, part of that was kind of jump started by the degree that I got. So
Mm-hmm.
I got my first job, and I guess my first move up in an organization was I was still working as a line staff, but I got promoted to admission coordinator, which was, that was kind of my first taste of this is what it's like to move from an
Mm-hmm.
entry level job to no supervisory responsibilities, but a little more authority. But then I went, and I've been planning to do this for years. I went back to school and got my PhD, and then with that, I started working as a staff psychologist my first job out of graduate school was with the NYPD as
Mm-hmm.
part of their psychological services unit. I went from there to working in State University of New York in Albany in their counseling center, which was where I met my wife, and also a psychologist.
Mm-hmm.
And then I got kind of back into my first love, which was working in acute hospitals, and I started working in the Albany, New York State Psychiatric Hospitals, kind of the equivalent of Chattahoochee in New York
Okay.
State,
Okay.
and went from there to the Delaware State Hospital. And in Delaware, that's when folks first started coming to me and saying, well, maybe you should do something more. Maybe you should be like a unit director or administrator. And I was very, very resistant to that. And I kept telling people no. It was like, I'm not in this to talk to clients. I'm not in this to, do paperwork. That's not my thing. I want to stay out on the unit. And finally, I remember in Delaware, the one of the senior administrators had a serious gap in their administrative array since someone's resignation, and came to me and sort of begged me. He said, "Look, you can keep being a psychologist, but I need to move you into this position." So that was my first real position of authority. I was the unit administrator over two, I guess they were both 45-bed units. So
Right.
it was a pretty big span. I did that for about a year, and then moved to Rhode Island, and I had the opportunity to go to work for a place called Bradley Hospital, which was still is a children's hospital, psych hospital. It's the oldest one in the country, and it's a major teaching affiliate for Brown Medical School. So I got to go up there. There was better compensation. I got to be in the faculty at Brown. Got to do a lot of teaching and work with them, but I also got to get out of the administrative track. So I got to just straight clinical work for about 5 years.
Right.
We moved to Tallahassee, and I was looking, and my wife is a native Floridian and grew up down here, so she got a job here. And I was looking around and talked to my predecessor here at Apalachee Center, the CEO before me, and he offered me the job of chief managed care officer. And I was like, so, I have to be straight with you here. I have no idea how to do that job. Like, I'm a psychologist. That's what I know how to do. I don't know how to do that. But I thought I'd come in, work here for about 6 months, and then go into practice. And, I got my license in Florida, and I was ready to ago. But after about 3 months of doing this managed care negotiation, I kind of fell in love with the business side of healthcare. So I stuck with it, and I was astonished that I liked it so much. But
Right.
it was sort of like, oh, this kind of feels like a fit for me too. So then when I was in that role as a member of the senior management team here, and when my predecessor retired, he encouraged me to apply for the CEO slot. And
Wow.
so that's when I kind of moved into that role. So that's the in a nutshell version of how I moved into the administrative world.
Right. But no, it's amazing stepping outside of your comfort zone, because you stepped outside of your comfort zone and you realize that not only did you find something that you love, but your skill sets also grew. Your knowledge base also grew. Your light was shining a bit brighter than you were probably giving it. So
I think that's a very good way to put it, and that's what it felt like. But the thing for me that's driven me my whole life has been a desire to learn new things. So it's you kind of, and the only way to do that is to push outside your comfort zone.
Yes.
If you're gonna learn something new, you've got to go to a place where you're new, you're an amateur, and kind of learn it from the ground up. So it's a good way of putting it.
Exactly. No, and I appreciate you sharing that with us, because I know myself, I have a specific area that I love, but listening to you and others who are listening to this, it's a reminder that you may have your comfort zone, you may have your love, but sometimes it's great to explore new things and challenge yourself, because you never know what you may learn about yourself or a new love you may develop.
Absolutely.
Yes, sir. I appreciate that.
Absolutely.
Okay. So you came to Tallahassee, you moved to Tallahassee. I tell people all the time, if you stay here long enough, Tallahassee will wrap its arms around you and won't let go, and you're going to fall in love with it. Yes. Yes. And so, well, I'll ask the question like this. Once again, as a native Tallahassee, I remember as a young child going to the skating rink on Capitol Circle, riding by Apalachee Center, but not necessarily really knowing what Apalachee Center was, not really asking questions, but not knowing. So could you give our listeners an overview of what the Apalachee Center is, and especially for those who may not have ever heard of the Apalachee Center?
Absolutely. So in Florida, knowing that the podcast may go anywhere in the world, so in Florida, the provision of publicly funded mental health services got pretty consistently privatized during the 80s, and one of the models that was used was the community mental health model. Apalachee Center has been around providing, in one form or another, providing behavioral health services since 1948, and we were the Leon County Mental Health Institute, became Apalachee Center in the late 60s, and expanded to the counties we serve now. So we provide really a full system of care, from, as you were mentioning, from acute inpatient and mobile response through residential, through outpatient, to the 8 counties in our service area. And so and as far as behavioral health goes, we do pretty much everything. It's medication management, psychiatric assessment, psychotherapy, case management, group therapy. I can kind of, the list goes on.
Right.
We're the largest center like this between Pensacola and Gainesville, and actually, this just got finalized about a year ago, but we've been doing it for a while. We have a partnership with Tallahassee Memorial Healthcare to manage the behavioral health center there, which kinds of it puts both Apalachee the Behavioral Health Center TMH into a single joint venture for the purpose of strategic planning. So we've got access to the BHC services such as ECT and their EAP councils, and so we have a pretty broad reach in that way.
Okay.
We accept anybody for treatment who meets our clinical criteria completely, just like neighborhood, completely regardless of ability to pay.
Oh, that's amazing.
Yeah, we also have 3 primary care clinics that we operate within the walls of Apalachee. So there's one in Madison, one in Gadsden, one here in Leon. And those are for folks who are already Apalachee Center clients who are receiving behavioral health services, but it allows us to provide the services all under one roof especially for folks with serious mental illness. Sometimes there's a higher comfort level in connecting with their primary care and their behavioral health care in one system. So, so that's kind of the thumbnail of what we do. We've got, and actually you said all this stuff, so I don't need to repeat it. We've got about, between the 2 systems, we've got about 700 employees, and and we treat somewhere around 12,000 unduplicated clients annually.
That's amazing. When I was reading that, I was like, wow, that's amazing. And it makes me feel good to know that people in the area are able to receive affordable mental health care, because that was actually going to be one of my questions, and I might as well ask it now. But just accessing the care. So similar to neighborhood, if a person, and just make sure I'm correct, if a person is either doesn't have insurance, maybe underinsured, or may not be able to actually physically pay for mental health services, they can still receive services from Apalachee Center.
Absolutely right. Yeah, that's where our job is really I'm very passionate about this, and part of this is my life in the field, part of it's my family history. Our job is to open the doors as wide as we can, so that cost is never a barrier to folks receiving services here. So yeah,
that's amazing. So yes, all of our viewers, all of our listeners, a free resource that you can access here in Leon County or in the surrounding or in the Big Bend area. So make sure you access Apalachee Center and spread the word. I know I'll be championing it more and more as well on our end.
Appreciate that. Thank you.
No problem. Now, you mentioned earlier Apalachee Center is one of the 3 major mental health centers in North Florida area. And so basically it's split up with the different county areas, and you are serving the 8 county area because this is the one major city or one major center in this area.
That's right.
Gotcha. Okay. And so people from other counties or people from rural counties, do they have centers there? Do you guys have outreach specialists, or how is the information being able to be spread to the persons in the rural counties?
Great question. So for each of the rural counties that we operate in, we maintain a bricks and mortar clinic, an actual building. So we've got outpatient centers in each of the 8 counties. We've got, I think, 4 outpatient locations here in Leon, but we've got 1 in each of the other counties. Gotcha. So folks should never be more than a 45-minute hour drive away from, and that's talking about somebody who lives in Steenhatchee who has to come up to Perry in order to access services. Right. But for most people, they're going to be 30 minutes away from their local center. And we do a whole lot with telemedicine. So we've got a telemed platform that we provide basically everything: psychotherapy, psychiatry, med management that folks can access from their home computer, from their phones. We've got both bricks and mortar clinics that folks can come into, and we've got connectivity through telemed for the rural counties.
And that's great. That is great, and I'm happy about that because you can access, or patients from different realms can be able to access you. Because I know we learned through COVID that we needed to have a digital presence during COVID. Our medical director didn't allow us to go out because she's trying to keep us safe. So I don't blame her, but having that digital presence in conjunction with the physical presence, you can be able to catch different aspects of your population, because some people may be tech savvy, some people may not. So
Exactly.
it gives you a wider range. That's amazing. And so now that during this conversation, you made me think, because you're talking about some of the different satellite offices that you may have in the area. So the Apalachee Center at Bethel.
Yes.
That's one of the active satellite centers that you have now. Okay. Now that's because I pass by it on a daily basis, because I'm in the Lincoln Center right down the street. So I pass by it on a daily basis. Okay. I'm going to make sure I start. I'm going to go over there and introduce myself to the staff there.
Let me tell you the story behind that.
Okay.
Really interesting one. So several years ago, I got a call from Dr. Holmes at Bethel Baptist Church, who's a longtime friend of mine, and he said, and I knew this, that he said, Jay, we've had this behavioral health center that the church has operated for years, that we are feeling like we're kind of hitting a wall with funding and with keeping it sustainable. Can you help? And I said, yeah, of course. Just need to call me. So Dr. Holmes is one of those people who really just needs to call me, and I'll kind of be there. So we went over and took a look at it. We talked for a while with Dr. Holmes and Dr. Fortenberry and his staff, and said, what would be the best shape of this? And his thinking was, well, you guys could you just open an outpatient clinic here? And I said to him, we can, we will, but we really want to keep the connectedness with the Bethel community.
Yes.
One of the things that's, I don't want to get too controversial here, but I'll just kind of go there a little bit.
Right.
I think it's a mistake for healthcare organizations to just come rolling into neighborhoods and communities. So,
I agree.
Hey, we're here to help. I think what you really want to do is to keep the lines of communication open with communities and community leaders, so that when the community say to you, hey, can you help us do this thing, that we can then say, okay, great, because we're being invited to the community.
Yes.
We're not just saying, hey, we're here to help.
Right.
Hold on a second, I have you popped out. There we go, I'm back.
All right.
So I said to him, well, we really want to keep the connection with the church community, and we want to make sure that we're working on things together. So we've done programs together. I've spoken at Bethel, and we've actually done a fair amount of different sorts of public programming messaging together. But as far as the clinic goes, yeah, we actually moved into the space, kind of refitted it, and we moved a couple of things. We have a federally funded, we have an outpatient presence there, so folks who are looking for med management and therapy can access that through Bethel outpatient. But we've also moved our assertive community treatment team into that building, and we moved our homeless outreach project, which works with, which has a federal grant. We moved that into that building, and with the faculty piece, the thing that was really nice about that was that we looked at, we kind of geo-mapped the zip codes of our faculty clients, and they were, in general, much closer to the Bethel Clinic than they were to where we were formally headquartered up here on Circles. We kind of like, we'll just move the whole team down there so that folks can get there more easily. So that's been, we're continued to, I think we probably serve something in the neighborhood of 300 clients through the Bethel Center, through one or another programs. So that's the story behind Bethel, but that's part of the Apalachee.
No, that's amazing. That's amazing, and I completely agree with your philosophy of you can't just show up in people's communities and dictate to them how you're going to serve them. You have to. They're the experts at themselves. They're the experts at their community. They know their lives, so you have to work with them, and that's the best way to build that continuity between the community and the providers. So I'm definitely with you. Yes, sir. Go ahead. You was going to say.
No, I was just going to mention that I think for me, a lot of that philosophy comes from the fact that I did, I'm a clinician. I spent 20 years just doing clinical work. And apart from certain very specific circumstances, Baker Acts, Marchman Acts, court orders for treatment, in most cases, treatment's voluntary, which means you can't roll up to somebody's house and say, hey, I'm here, I'm going to start doing therapy with you.
Right.
You have to walk through the door. And so I think if you apply that same thinking to communities, it's kind of the same thing. It's like, you can't just show up and say, hey, look how lucky you are, we're showing up and here we have problems. You have to have the relationships that say, we've got these resources. If you'd like to work with us, if we could provide some resources within the community, just talk to me, and then we'll figure out a way to do it. But that leaves the agency, it leaves the authority with the community seeking support. That's where it belongs. It doesn't belong to me, it belongs with the community.
No, I definitely agree. It has to be a healthy back and forth relationship between the community. When I first started working at HIV/AIDS, one of the gentlemen who kind of taught me some of the things that I learned, he kind of put it like this: we can go into people's communities and we can have all the will and all the resources to serve them that we want, but if they're not going to allow us to serve them, because at the end of the day, they have the choice to allow us to serve them. And if we're pushing ourselves on them, we're not, they can see that we don't have the mindset to give them the best quality service. They're in their full right to refuse to allow us to help them. And if you find yourself in those situations, then your approach needs to change.
Exactly. Couldn't agree more. That's a great way.
Yes, sir. Yes, sir. You should be solving problems without creating more problems.
Exactly right.
Yes. So, 40 years in mental health. What is one of the greatest lessons that you've either learned about serving the community or learned about yourself working in the capacity of mental health?
Oh boy, those are good questions. On the community side, in terms of the provision of mental health care in general, I'd say the longer I'm in this field, the more I'm convinced that the root barrier to excellent care is prejudice. That's it. Because you go along and you go to, I'm involved, as you mentioned, I'm involved in a whole lot of community stuff at the local and state levels. And you hear a lot of rhetoric about the system being broken and the system being underfunded and things like that. And the fact is, in Florida, in the last 3-4 years, we've had a flood of state level funding into mental health. We've had been able to open, just this host of new programs for, and we've got to the point now where we've got a first lady for whom this is like her passion. So she's been very public about the need for mental health services in the community, and that's all been hugely helpful. I think when I kind of look back, I think, there's funding issues, there's staffing issues, there's all kinds of stuff you have to kind of work with, but the root cause of all the barriers we face has to do with the society at large. It's difficulty kind of thinking through the implications of behavioral health issues being medical issues, because that's what they are.
Right.
Folks who are dealing with ongoing moderate to severe behavioral health issues. And listen, just like physical healthcare issues, mental health care issues hit everybody without exception. There's nobody who stays right on beam their entire lives. Right. And there's a whole lot of different ways, which don't even necessarily involve treatment, to work with folks who are hitting the milder end of the spectrum. There's different strategies people can use to, combat mild depression, mild anxiety, and it's very effective. But as you move through the spectrum to more moderate, more severe issues, you're talking entirely about, and this is more true the further into the realm of severity you get, you're talking about genetically and biologically determined, symptom state.
Exactly.
Right? So the implication of that, if you think that that's just science, we know that for a fact. So, we know the law of gravity. So if you think through that, though, what that means is that this sort of subtle shaming and embarrassment about mental health issues, the subtle cultural pressure to say, stop being so crazy, stop acting nuts, pull yourself up by your bootstraps, straighten up, none of that stuff works. All it does is to shame the people and the families who are dealing with this. If we made the movement, and we're starting to, I'm watching it, but if we can truly make the movement as a culture to a place where people aren't any more embarrassed of a mental health issue than they are of diabetes or high blood pressure or cancer, which are seen accurately as genetically determined, in many cases, genetically and environmentally determined challenges, but they're not shaming for the person dealing with them. And then I think you'd see a flood of federal resources coming into, you'd see more people going into the field to work in it, and you'd see a much healthier relationship between the mental health delivery system and sort of the general public. So I think that's the core takeaway from me from, 40 years doing this, is that it's the stigma and the prejudice that we have to kind of work on. And so, for me, what that has translated to has been, over the years, an increasing involvement in presence in public discussions. And for me, it's like here in this region, my mantra has been for a number of years, if people are talking about mental health here, I want to be at the table for that.
Yes.
I don't want to not be at the table.
And you're literally at the table.
I'm trying my best.
Yes.
Tables, but I'm trying to get to them all to just keep that conversation going. And the more we get in a podcast like this one, the more we can talk about this and bring it out of the shadows and into the light. the better we'll do. So that's kind of my, that's my soapbox moment for the day. That's where we need to go.
It's greatly appreciated as well. And I will say this. I've worked in HIV/AIDS prevention for 14 years. I would say the last 5 years have been very helpful as far as the change in our overall, and when I say our, Tallahassee's overall outlook when it comes to mental health.
Yes.
When it comes to access to mental health, talking about mental health resources. I work in Frenchtown and I live on the west side of town off of the Lake Bradford area. I remember growing up, and I still see now, there are plenty of people who have mental health issues. We can see that they need access to it. They may have access, but they may not. What makes me feel better now, especially after this conversation with you, is resources are available and resources are affordable. And I want to make sure that Neighborhood Medical Center is more a part of making sure that our residents know about the resources and they can access them. I want to make sure that we can work closer together and do more events and just do more outreach within this community, because you guys are like us. We're here for the people. Our patients come first. We're client-centered, and if we don't help fix our community, what are we really doing?
Right, exactly right. Then go do something else. Yeah,
exactly. So I usually have my final question is usually what have we learned, or one of the big things that has stood out. But I think we already covered that earlier when you talked about stepping out of your comfort zone and challenging yourself, because that's how you became the man you are today. That's how you have the accomplishments that you have today. And I just want to reiterate that for our audience. And I thank you for telling that part of your story.
My pleasure.
Yes, sir.
Both of my mom was a nursery school teacher, and my dad, who died when I was 3, so I never really knew him, but he had been a high school teacher. So education was kind of in my blood, and the piece of that for me was that really resonated was, if you're not learning something, kind of what are you doing? And
right,
hugely fortunate to have been called to a field in which there's always so much more to learn, which is actually kind of cool. Like when you're younger, you feel very daunted by that. I remember talking to my dissertation advisor back when I was getting my PhD, and I said to him, I was looking at the area of juvenile behavior issues and culture, and I said to him, I said, so there's a lot of literature on this. Like, how much am I expected to know for my oral defense for my dissertation? And he just looked at me kind of dumbfounded, and he said, well, Jay, you're getting a PhD. You have to know all of it. Like, you have to learn all of it. There's none of it you don't get to learn. So at the time, I was sort of like, oh my God, this is so overwhelming. But the older I get, the kind of the more grateful you never get to the end of this. You can keep, when I'm 90, I'm, knock on wood, I'm still going to be in a position to still feel like kind of a beginner in the mental health world, because there's so much to learn. So that's a great thing.
Yes. Now it definitely is, but that's also I'm grateful for you saying that. I know exactly how you feel when you talk about looking at the scope of something and feeling overwhelmed and like, oh man, that's a lot to learn. There's a lot to go, or even if it's an obstacle that you may have to overcome, but just take one step at a time and just trust yourself and just go with the process, and you'll be able to reach your goal. And that's what I'm learning from you and your story. You believed in yourself. You took advantage of the opportunities that you had, and not only of that, you make sure you gave back to others so they can have the opportunities, and that's greatly appreciated.
Well, thank you. I've tried my best. I had a whole lot of help. So
yeah, definitely takes a village to get where you need to go.
Exactly.
Yes, sir. Yes, sir. So I want to make sure I say it correct. So contact for our viewers to be able to contact the Apalachee Center. The website is apalacheecenter.org, and I'll spell it as APLACHEE Center. Go ahead.
APALACHEE Center.org.
Yes, sir.
Yes.
And so I see office number 850-523-3333.
That gets you into sort of the general the phone system that can direct you to different departments. One thing, I don't know if you've got the MRT number up there on the screen, but that's something I always like to let people know about. Our mobile response team, which is available 24/7, and that's 800-342-0774. And folks can call that anytime, day or night, if they're in crisis or somebody else in crisis that they want some advice and help with.
Yes, and I will make sure I include the link to the website and this crisis line in the description of this video, so all of our viewers can access that. But Dr. J. Reeve, you are exceeded expectations. I already knew you were a great person, but been able to have this conversation with you, I greatly appreciate you. I hope this is not the last time you and I have a conversation. I would definitely like to sit down and talk with you more. Also see how neighborhood and Apalachee Center can work more together. It's a great, once again, it's a pleasure, it's an honor as a Tallahassean. I just like to make sure I give the flowers and give the praise and the love to people who come to our city and are truly serious about making Tallahassee better. I greatly appreciate you, Doctor.
I'm very flattered by that. Thank you. This has been a whole lot of fun for me. I've really enjoyed it. And you know that you do. When you do a fair amount of media appearances, you're kind of used to a small sound bite and having the luxury to actually have a conversation with you being in the field. And so this has just been fun for me. So I would welcome further conversations and further collaboration between neighborhood and Apalachee. Great.
Yes, sir. I greatly appreciate you, and we will make that happen. So for all of our viewers, once again, this is one of our great resources and our great people in Tallahassee, Dr. J. Reeve. And remember, all of the information will be in the description to contact Apalachee Center. We appreciate all of the views. Make sure you subscribe to our YouTube channel, share this video, comment. We want all the comments because that helps the algorithm, so it helps more people see, so more people can know about the resources. Dr. J. Reeve, CEO of the Apalachee Center in Tallahassee, Florida. This is how we do it. This is Mind, Your Body, and Soul. Remember, our website is www.neighborhoodmedicalcenter.org, and our podcast website is nmcpodcast.com. I am Joseph Ward, and we will see you guys next time.